Welcome to the Greater Winter Haven Chamber of Commerce Ask the Doctor series. This series is being done in partnership with Baycare's Winter Haven Hospital to help you, the community, learn more about our local physicians, as well as the many services and programs Winter Haven Hospital provides to keep our community healthy and thriving. On today's episode, I have the absolute pleasure to speak to Dr. Vriti Advani. Dr. Advani specializes in general surgery with a focus on pancreatic and biliary surgery, surgical endoscopy, and interventional ERCP. Well, welcome to the show. We really appreciate you coming on today.
Oh, thanks, Katie. Nice to see you.
So one thing I love to do when we start these Ask the Doctor interviews is to learn a little bit more about you as a person, where you grew up, and kind of what brought you to Winter Haven.
Yeah, I'd love to tell the story. I get asked it a lot. It's probably my most common question that patients ask me when they meet me. The first thing they always ask me is, how old are you? That's like the number one question. The number two is, where are you from? Because, obviously my accent's a little, it's a little scattered. So I am half Indian and half Filipino. I was born in the East. I was born in India, in a city in India called Calcutta, and I lived there till I was 10. And then our family in 1992 moved to Trinidad and Tobago, which is an island in the Caribbean. It's a British Commonwealth island. And so I was educated in sort of a British system, a British high school system. And following which, when I was applying to universities, it's very normal that most of us would go to universities either in England or Ireland because it's a British Commonwealth island. So I ended up applying to Ireland, and my brother went to England, and that's where we went to med school. So I moved to Dublin, Ireland when I was 18 years old, 18, 19. And then I went to medical school from 2001 to 2006. It was a combined 5-year pre-medical medical school program. So it was like a fast track. Mm-hmm. But it was a great 5 years because, you're in Dublin, you're in Ireland, the people are nice. The school was phenomenal. I went to a school called the Royal College of Surgeons, really prestigious school. A lot of kind of, a lot of famous European surgeons graduated from that school, so they have a lot of heritage. So it was a great experience.
Well, that's amazing. So you got to grow up on a tropical island, and then you get to go to college in one of the most beautiful countries in the world. So yeah, so you've done really well.
Yeah, the Irish are super nice, super friendly. They love to drink, just like the people on the islands. Mm-hmm. So it was an interesting experience, and the Irish are just so friendly, and it was a good fight. I was there for 5 years in terms of schooling, and then I actually did 3 years of like my residency training there because I was significantly younger than the American medical school graduate. So I was very conscious of that. My aim was always to move to the United States and do my formal surgical training and my fellowship training and to go into practice in the United States. So when I graduated medical school, I was 23. And the average age of medical school graduates here are usually 20, 27, around that. So I stayed on in Dublin for about 3 years, and I did some more like surgical training, like their own residency program, until I was sort of the same age as the American intern. And then I applied to residency program here and got in.
And so where did you do your residency program?
Yeah, I did my general surgery residency program. It was 5 years of straight training in Springfield, Illinois, which, when I applied, a computer sort of matches you based on your interview process and everything. And I did not know Springfield was the capital. I was like, oh, it's the capital of Illinois. Great. So it was kind of a small city, but very good training because the program I trained under was the Southern Illinois University School of Medicine. And they have this amazing surgical training track where you're trained by academic surgeons as well as surgeons in the private sector. So I got like a really good feel for both sides of practice at a very young time of my career, at a younger age. So
yeah. Oh no, that's amazing. And to be able to have that practical experience to see what's happening out in the real world at the same time, that's invaluable.
Yeah, and I always tell people surgery, being a physician, it's all about people skills and relationships. And the books only take you so far. At the end of the day, you have to kind of really be able to connect with people and see what actually makes them what they actually need. And being trained in the private sector as well as in the academic sector, I really feel like I got the best of all possible training. I mean, we were a level 1 trauma center, so we did all of that as well. I did a lot of research during my residency training, and actually when I was training, I was convinced I was going to be an academic surgeon. I've written papers and I always wanted to be number one, and I was like the first to try and answer every question. And I said, I'm going to be a colon and rectal surgeon. This is what I want to do. And I was, really bent on doing that for about 3 years. And then in my 4th year of training, I kind of had to take on the job of administrative chief a year earlier than normal, because one of our chiefs ahead of us had, I think they were called out into the military or something like that. Anyway, and they were restructuring the program. They said, we are changing everything. Now you are no longer going to be assigned to a service, but you're going to be trained in an apprenticeship model. And I said, oh no, like 4 months with one surgeon doing like all his stuff and living his life. I don't know if I can do that, but that's what I did. And it was through that process that I totally changed my mind. I said, you know what? I think I like private practice. I like pancreatic surgery. I like ERCP, the complete opposite of colon and rectal. So, again, it was definitely like a really great learning process.
So once you decided that that was the track that you were going to go on, what actually made that leap to come to Florida?
Okay, so when I was applying for fellowship training, so the fellowship training that I was looking for was, there's not a lot of spots. There's like a 5-year waiting list throughout the country. I was sort of too late at deciding. So I was like, man, I don't know what I'm going to do, but I'll just put my application out there. And again, the fellowship was for pancreatic and biliary surgery, surgical endoscopy, and ERCP. This is basically a blend of 2 different specialties, kind of created by an elite group of surgeons, and they kind of hand and cherry pick who they want. And I never even heard of this combination. So I said, I'm like 5 years too late. How would I even get in? So the one of the surgeons, his name was Dr. Fullerton. He was the one I did my apprenticeship under. He said, I know a guy. I'll give him a call. I said, okay. And really, this surgeon, his name is Gary Vitale, Professor Gary Vitale, out of the University of Louisville in Kentucky. He called me. He said, hey, why don't you come over and let me interview you? And, there's a 5-year waiting list. I said, yeah, I know. I'll come out to the interview. So I really just thought I would just go and just wing it. Let's just see what happens. And, I met him and he gave me the job on the spot. He actually created a second position. So I really feel like it was sort of ordained for me, so I went into it. That was 1 year. And then when I was looking for a job, it was one of those things where there are not many places who want a surgeon who does ERCP. They're sort of competing specialties. ERCP is predominantly a GI specialty, and a lot of the medical gastroenterologists really like to keep that as part of their one of the services they provide. So again, I was faced with this. Who's going to hire me? Why did I do this fellowship? This is the craziest thing. I should have done colorectal. Anyway, I applied everywhere, and they'd call me and say, yeah, the GI group here really doesn't want that at all. So I really needed a place that, and plus I wanted to be in private practice in a clinic setting. So one day, Richard Honer, I don't know if you know him, he's a colorectal surgeon with Gastro Clinic. Somehow, I don't know how, he got my CV. He called me and said, hey, we're a surgery group here, and we're looking for a surgeon who does pancreatic surgery and who does GI work and who specifically does ERCP. I said, wow, okay. So I came here and interviewed, and it was one I immediately knew. Even despite being so different from Dublin and Springfield, I just immediately knew that this is where I was supposed to be. So,
Wow, your story is a story of everything happens for a reason. I mean, really, one thing that happens to the other that happens to the other. And,
Yeah.
Dr. Honer, he's very well known in the community. He's a very
Yes.
generous individual.
Yes.
He's even been honored with the Chamber of Commerce's Bankers Cup Award in the past.
Yes.
He's just, a very philanthropic individual.
Yes.
So you joined a good group there at Gessler Clinic for sure.
Yeah. And, he was just so warm. And I was like, he was very calm, very kind of almost like, yeah, come down here, interview, see if you like it, whatever, we'll figure it out. I said, okay. And I liked it. And, they call me, they're like, okay, well, what terms would you like? I said, I don't know. I don't know what terms I want. I don't even know what to ask for. So anyway, whatever I asked for, I think I Googled it. I don't even know what to ask for as to like what I should ask for in my job. But they said, yeah, you got it. That's fine. So I came to Winter Haven. August of 2015 was my first. Oh, so yeah. So I'm exactly in August. Yeah, August 8th, I think, was my official start date, 2016, and I've been here since with Gessler and with Winter Haven Hospital, of course.
Wonderful. Well, we are very lucky to have you. That is for sure. And someone as accomplished as you.
Oh, thank you.
So let's talk a little bit more about your practice. So explain to everyone, what your title is. You've explained that it's very unique, obviously, that having this combination of training is unique. So explain a little bit about what all that encompasses.
Yeah. So the first part of what we do, of course, is general surgery. And pretty much everyone's a little different as a general surgeon, but I operate on anything in the belly, pretty much from the rib cage down, below the rib cage down to your pelvic area. And my most common general surgery procedures would be a lot of robotic hernias. I do a lot of laparoscopic and acid reflux surgeries, hiatal hernia surgeries, and of course, a lot of gallbladder surgery because biliary work is sort of a specialty that I trained in. And then, of course, there are people who, general surgery, you have to be able to operate on the pancreas and also operate on like a little skin tag if you had to. So it's really anything in terms of in the belly for general surgery. The GI part, I do all the upper endoscopies and the colonoscopies that someone may require, as part of what routine medical GI involves. But I also offer ERCP, which is specifically endoscopic evaluation of the biliary tree and the pancreatic ducts. My most common reason for doing that would be someone who maybe is jaundiced or has stones in their bile duct and they need these stones removed. In the past, we would have to do open operations to open that common bile duct and remove these stones manually, and then sort of a long process for a patient. But with ERCP, it's an outpatient procedure. It's a scope. There's no cuts, and I take the stones out, and then I address their gallbladder at a later date. Very rarely, there are some people who I will do the traditional open common bile duct surgeries on if they have, if for whatever reason they can't have an ERCP. And then finally, the kind of niche that I feel like my practice has really developed is pancreatic work. That's our real specialty. We do a lot of pancreatic cyst surveillance, management of pancreatitis, pancreatic cancers is very big. We do Whipple surgeries here at Winter Haven Hospital. So yeah, that's kind of like all of what people come to see us for.
Well, that's a lot. So, and to the layperson like myself, it sounds like going into a practice like yours would be very beneficial, being that sometimes I might have the symptoms, but I don't know what's causing them, right? I mean, I'm coming in with particular symptoms, but because of the breadth of services that you provide, it may be more likely that at least one of those symptoms is tied to an area that you have an expertise in. So talk a little bit about what symptoms typically bring a client into your office.
Yeah. So because I'm always in the belly, I mean, the most common presenting complaint I get when a doctor refers a patient is abdominal pain. So, it's my job as the consulting physician to kind of get to the nature of it. Like, when are you having the pain? What's bringing it on? Where is it exactly? And I like looking at my own scans. So oftentimes The primary care doctors, they're very busy and they scan the patients and they do all this stuff, and they kind of send the patient with a barrage of images and reports, but really, unless someone who works in the belly physically looks at the scan, it's very hard to try and explain something to a patient. So the most common complaint or something someone comes to me with is abdominal pain, and usually I figure out it's either an ulcer or a gallbladder problem, or it could be anything GI related. The pancreas is tricky. People usually have vague symptoms, like weight loss, diarrhea. I'm diabetic and I don't know why. My eyes are yellow. Someone in my family has a cyst. Someone in my family has pancreatic cancer. So those are very vague. But we're very lucky because, at Gessler or even all the offices here in Winter Haven, if I can't get my patients worked up at Gessler, I send them straight to Winter Haven Hospital. They can get their blood work and their scans within 48 hours, and we can have some answers for them. So,
yeah, that's an important collaboration to be able to get answers for your patients in a timely manner.
One of the studies, particularly where I send a lot of patients to Winter Haven Hospital for, is an upper GI series. So say someone is having acid reflux and the medicine is not helping, I do two things. I do an endoscopy, but I also do an upper GI x-ray where they drink dye and they swallow the dye, and we can x-ray them at the same time to see what's happening when they swallow. So we're always backed up in the clinics at Gessler and Bond Clinic. We just cannot they're like booked like 3 weeks out. So oftentimes I shoot them straight over here to the hospital and they're able to get them in. So it's a good collaboration.
So do all the patients that come into your office, I mean, obviously you're a general surgeon and that's what you've been trained for, but is surgery always the end result of someone that's coming into your office, or is there a myriad of treatments that you would try first before they end up going through surgery?
Yeah, so I think this question most often, I'll apply it more to like acid reflux, because there's so much other management other than surgery, and then pancreatic problems. Everything else, gallbladder surgery, gallbladder, it kind of needs to come out. There's if you have stones, it's just going to be a problem if you don't take it out. Acid reflux, for the most part, I try maximal medical therapy to help the patient avoid the surgery if possible. And maximum medical therapy is acid reflux medication, lifestyle modification for at least a period of 12 weeks to see if there's any improvements. And if there's not, I offer them a laparoscopic hiatal hernia repair with Nissen fundoplication. It's a very traditional anti-reflux procedure. We do we do a lot of them here in the hospital, and it's laparoscopic. They stay overnight. And it takes me about an hour. So people do get good results. But that particular disease process, I try my best to offer them, a non-surgical option if they do well. Pancreatic stuff, very rarely do I need to operate on a cyst on the pancreas. I tend to sort of watch them, and only if they start changing, we start, sampling them. And only if the sampling shows questionable cells do I actually consider an operation. With pancreatic cancer, there's usually a very small window where we can operate. And so if I see someone who comes in and they have a cancer and I look like we can cure it with surgery, I offer them that surgery up front. We don't really mess around with, trying alternative therapies, because the data is very clear that a combination of surgery and chemotherapy is the closest chance for cure. So.
Now, if a patient or a community member that's watching this video wants to come see you directly, do they have to do it via referral, or can they make an appointment with your office directly?
No, they can directly call the office. I think some insurances, I don't know which ones, but it's very insurance dependent, but they can call Gessler Clinic. They can say, I'd like to make an appointment to see Dr. Advani. They'll put them through to Area 5, and they'll just ask you your insurance information and what you need to see Dr. Advani for. And I believe they'll tell you if you do need a formal letter of referral. And it's not something that we leave up to the patient, because if we know we got the call, my nurse herself will call that patient and find out the primary care physician's information and get that referral sent over so we can take care of people.
Oh, that's wonderful. That's wonderful.
Yeah.
Well, I know if people are interested in learning more, they can certainly go to gesslerclinic.com or winterhavenhospital.com. But is there anything else you want the public to know?
We offer so much. I mean, I'm just one of the surgeons at Gessler Clinic. I have a partner, David Spire. I'm sure you know him. He's a very well-respected surgeon in the community. He does everything. I mean, he can operate with a flashlight and a stick if you give it to him. This is one of the things, you know, like if I don't know what to do and I call him, he somehow just knows if something's not working. This one time I was operating and I couldn't get like one of the technical instruments to work. This is a funny story. So I called him in. I said, Spire, do you know how to fix this instrument? He goes, yes. And he took it and he banged it on the table and it worked. And I said, that's unbelievable. Thanks.
He's the MacGyver of surgery, apparently.
He is. He's such a legend. So having someone like him is so good. And, he's my first assistant for all my Whipples, which is one of the big cancer operations on the pancreas. It's great to have someone like him just operating together so we can, get people off the operating room table faster. When I trained doing Whipples, I mean, if I did it on my own, it would take me about 5 hours, but with another surgeon, we have that time down to 3. So 3 hours is very good for a Whipple. So he's great. And he does a lot of stuff that I don't do, like vascular surgery and thyroid surgery. And, he could pretty much operate on anything. So he's a great partner. And then we have a new addition to the practice who does bariatric surgery. So he's really good.
So it really is.
Dr. Poner, so
yeah, it really is just complete care, which is so amazing. And one of the themes of the Winter Haven community, and I promised to our listeners I did not feed this to you in advance, but collaboration is one of the underlying pillars. Like literally one of our brand pillars is that we're a collaborative community. And so much of what you talked about in this interview underscores that, from the collaboration between Gessler and Winter Haven Hospital to the collaboration between the surgeons that are on your team there at Gessler Clinic. Just amplifies how the citizens of Winter Haven can get such complete care without having to leave this community.
Absolutely. And it was, when I first came here, there were a lot of patients who were being sent to Moffitt and, tertiary centers, it's great. I think they do offer, if you have something super rare or failed management, failed treatment, and you need to be part of a trial, being in a tertiary center is really good, especially if we don't offer that service. But unfortunately, when you're sent out there, if something happens and you present here, we just don't have the records, and then we have to send you back to the other hospital. So it's great to be able to have comprehensive care with all the specialists that we have now. Very rarely, I don't do liver surgery, and we don't do formal liver surgery at Winter Haven Hospital. So if I feel someone needs part of their liver, like a formal liver resection, I will send that to. But again, within the Baycare community, because I send them out to Dr. Sukaramwala at St. Joe's in Tampa, because he's a liver surgeon. So again, we kind of have a really good community of physicians. So.
Well, that's wonderful. And, I have to say it's wonderful to get an opportunity to do these interviews, as I mentioned to you, because you get to know the doctors a little more personally as well. And I could just tell you're just such a warm and fun individual as well. So I just want to thank you so much. It's been such a pleasure to talk to you this afternoon and to learn more about you and more about your practice and the services that are provided right here to the Winter Haven community.
Thank you so much.